Good evening. My name is Anthony Collins, and I'm a caseworker for a local firm that specializes in the psychiatric treatment of childhood developmental disorders such as ADHD, conduct disorder, childhood anxiety and depression, and cognitive developmental difficulties relating to children with autism spectrum disorder. Recently, I was approached by my employer with the case of a 12-year-old boy named Andy whose difficulties focusing on particular aspects of his schooling as well as many of his social interactions, was beginning to have a negative effect on his overall quality of life. Andy, who tended to do well on multiple choice assignments at school, reported that he has lately been having difficulty coherently assembling his thoughts in order to perform well on more complex assignments, such as research papers and assignments that involved answers in the form of an essay. Apart from his difficulty performing satisfactorily on written work, Andy also reports that his difficulty gathering his thoughts persists when he is called on to answer questions aloud in class. Compounding these academic struggles, Andy's interactions with his friends have also begun to suffer, which, as a pre-adolescent child, has caused a significant blow to his self-esteem. Andy's parents, who in comparison to the parents of Andy's peers are quite older, report that Andy's preschool physical examination showed no physical or psychological deficiencies. After conducting several interviews with Andy, I found him to be quite a pleasant young man who shows no signs of conduct disorder and does not register on the scale of autism spectrum disorder. All findings taken into consideration, I am of the opinion that Andy is suffering from mild symptoms of attention deficit hyperactivity disorder. My findings are based on the fact that Andy, similar to many children with ADHD, seems to have trouble primarily related to difficulty focusing for extended periods of time. This explains why he is able to perform tasks such as multiple choice examinations relatively well, whereas when he is faced with scenarios in which he must remain focused, as is the case with written assessment, he tends to lose focus and experience difficulty gathering his thoughts. I believe that Andy's diagnosis of ADHD is tied to the fact that both of his parents report being diagnosed with ADHD as children. Since ADHD has been found to be highly heritable, 70 to 80% according to Kring and Johnson of 2018, Andy likely inherited the disorder genetically. ADHD is an externalizing disorder, meaning that it is classified by outward behaviors such as noncompliance, hyperactivity, and impulsiveness. My treatment recommendation is to first educate Andy, as well as his parents, about the symptoms of ADHD so they can better understand his behavior and recognize that he does not intentionally act in a way that causes his troubles. Additionally, I would recommend Andy to a local childhood psychiatrist who can prescribe an appropriate dose of Ritalin to aid Andy in gaining control of his hyperactivity. I believe that the combination of psychoeducation and properly prescribed medication will aid Andy and his parents in overcoming the difficulties that have been causing the trouble they seek to remediate.